am Dr. Juli Owens, and I'm one of the staff doctors here at Georgia Chiropractic Neurology Center. And today we're going to be talking about functional neurological disorder. So first, we're going to start with what is functional neurological disorder, and we're going to shorten that to FND. FND is a disorder of nervous system function where the interconnectivity or signaling between different regions in the brain and body are aberrant without a structural cause. So FND sits at the intersection of neurology, brain physiology, psychology, and nervous system regulation. So the big takeaway here, and then we'll be talking about that a little bit more today, is that the hardware is intact, but the software is malfunctioning. So if you've ever had a computer that you know the computer is working well, but you're trying to pull up one of the apps and the apps just won't connect, that's kind of what we're looking at here. So the brain itself and the interconnectivity in the central nervous system, as far as the actual structure, is all there, but the electricity and the messages and all the things that are working to connect to each other and talk to each other are just not quite functioning in the way that we would find appropriate. And so I want to start with just saying that FND symptoms are real and recovery is possible. And so for many people with FND, they've dealt with oftentimes a lot of having to fight through the medical system to just express the fact that their symptoms actually are occurring for them. And so at Georgia Chiropractic Neurology Center, we view this as a true diagnosis to have neurological effects that are happening in your body for a host of different reasons, and not just some form of malingering or made-up experience that a patient has occurring, because I just think there's too many people in the world that have this going on. So FND affects millions of people worldwide, and many patients go lots of years without answers. And many people are told that their tests are normal, their MRI looks fine, nothing's wrong, and it's just anxiety. And while there probably is a component in a lot of cases that you're anxious because of the things that are happening in your body, or anxious triggers can cause certain things, we don't view this as a pure anxiety disorder. We view this as neurological effects from things that are happening within your body and brain. So first, we need to differentiate that. So in a functional neurological disorder, many of the tests do come back clean. So your MRI looks fine. The structures are often visible and don't have damage on scans, which is opposed to things like a structural neurological disorder. So in a stroke or MS or people that have brain tumors, you can run different studies with your neurologist, and they can come back and they can look and they can go, this is exactly where your stroke happened. So these symptoms make sense to the brain areas that have been affected by your stroke. And now that makes sense to your symptoms. And unfortunately, with functional neurological disorder, because your structure is intact, they often can't discern or understand where the misfunction or dysfunction is coming from to be able to explain the symptomatology of these functional neurological disorders. So the problem lies in how the networks or how the different places in the brain are communicating with each other, which means that you can have dysfunction in many areas or different areas in your brain. So one FND disorder may not look like somebody else's FND disorder, but there is modern brain imaging that does show changes in function even when structure is normal. So there are different functional MRIs or PET scans that are coming out that are showing differences in brain activity that allow us to better understand this, but it is something that medicine is progressing in at the moment. So to start with understanding FND, I think you have to have a little bit of the history of where this diagnosis comes from. So FND has been, in my opinion, diagnosed a lot more here recently in most recent history. However, FND had descriptions in medicine or been described in medicine all the way dating back to 1900 BC. So this is not a new diagnosis, but there has been a lot of change in the way that we understand and diagnose it. So in the 19th century, Jean-Martin Charcot identified it as hysteria major, but he also started to describe it as dynamic lesions in the brain, which is different than what it was originally described as, which was just hysteria. And so now he's starting to say, no, there are actual things happening with the brain functioning. And on top of that, he said it's in both men and women. So of course, back in those days, just women were allowed to be hysteric. But he said, no, this happens in men and women, and there's something actually going on with their brain. They're not just hysteric. And so these patients typically were just described as having some form of psychological disorder. And in the 20th century, it became known as conversion disorder or psychogenic neurological disease or somatoform disease. So what that kind of got pushed into, because this is part of the DSM-5 diagnoses, which is the Diagnostic and Statistical Manual of Mental Health Disorders, they basically said, well, these are psychological symptoms that are now manifesting in true neurological deficits. In 2013, the DSM-5 reclassified it as functional neurological symptom disorder. So we're not looking that many years back at the changes in medicine and how they've progressed to understand this disorder and how they've progressed to define this disorder. But then the most recent change actually came in 2022. So we're not looking that many years ago, where the DSM-5 TR, which is the text revision for the DSM-5, came out and said FND is not any longer a diagnosis where you have to have a psychological stressor for the diagnosis. Now, that still occurs in many of the FND cases and how they're diagnosed. There oftentimes is some form of emotional event that happens or a psychological stressor that happens. However, that was a really big change for them to come out and say, you can have functional neurological deficits that are not explained by brain scans, and simultaneously, you now don't have to have this psychological, psychiatric, problem to explain the fact that you have a neurological deficit. So that was really big. The other really big thing is that FND changed from a diagnosis of exclusion to a diagnosis of inclusion. And so what that means and how that works is that a diagnosis of exclusion is something like fibromyalgia used to be, or a bunch of different disorders where, because your symptomatology does not fit the bill to one exact diagnoses, meaning we can't go in, look at the MRI, see where the brain lesion is to understand that you have a tumor or see your stroke. Because we don't have this beautiful, nice bow on top tied criteria to explain your diagnoses, we've tested out the fact that you don't have all these other things. We've looked at your blood work. We looked at your MRI. It's not MS. It's not a stroke. It's not, all these different things. And so because all of these other things cannot be factored in, then we have and are factored out, we now can say, well, we'll give you a diagnosis of FND. That's now changed to where there are positive clinical findings and specific testing that you do with a patient to identify the fact that it is FND as opposed to another disorder. So one of the people that I've been looking at a lot, his name is John Stone. He's a researcher at the University of Edinburgh at the Center for Clinical Brain Sciences. His paper, most recently published in 2024, he has multiple papers along the way where if you watch his things, you can almost look at the progression of how FND is changing. And so by that, I don't mean how FND is changing as far as a patient's clinical presentation, but how clinicians are actually looking at the disorder and classifying it and understanding it. So these are just a few direct quotes from this paper that he wrote called FND Defying Dualism. And if you or a loved one is dealing with FND, I highly recommend you just copy and pasting this into Google and finding this paper, because it has a really great kind of history and understanding of FND. But one of the things he wrote is this disorder has been passed back and forth between neurology and psychiatry for 150 years. And defying dualism in FND may cause dissonance in clinicians, in those seeking tidy explanatory theories, and in classification systems. So again, this is the understanding from clinicians that there's not this beautiful, present that you're wrapping a bow on top and going, this is the diagnosis, right? Because there is so much variety and there's so many different symptoms and so much misunderstanding or misrepresentation of this being purely a psychological disorder, we're now seeing that because of how we're classifying it as these different, being a diagnosis of inclusion and understanding that there are true neurological deficits that aren't purely explained by psychological events, there's a lack of or a dualism in clinicians' understanding or diagnosis of this disorder. FND is actually is a common condition, one of the most common seen by neurologists in both outpatient and inpatient settings, making up 5 to 15% of patients. It accounts for 50% of people rushed into the hospital with suspected status epilepticus, so that's non-epileptiform type seizures typically, and then 8% of people admitted to the hospital with suspected stroke. Because it can mimic so many different types of disorders, and because when there's not that clean findings on MRI, but there's real neurological deficits, clinicians often have a hard time with a FND diagnosis, especially when you look back at the history of this being labeled a psychiatric, hysterical, almost malingering type of event. But at Georgia Chiropractic Neurology Center, we definitely understand that there is a real cause and a signaling issue in your brain that helps with us understanding that this is causing actual true neurological deficits for people. So this is by no means a comprehensive list of how FND can manifest, because it can manifest in a variety of ways, but these are just some of the most common symptoms that people with FND experience. One of those can be weakness or paralysis. That can also be something like chronic pain disorders, tremors or abnormal movements. This is where that motor system is having its issues. You can get weaknesses, you can get changes in gait. That's also what I would consider like the non-epileptiform seizure part. Chronic dizziness, speech disturbances, and cognitive fog. So because it can affect your motor systems, because it can affect your sensory systems, and because it can affect other neurocognitive areas of your brain, you can have things like brain fog, you can have things like numbness or dizziness or even visual issues that are all understood or explained with an FND diagnosis. And so what can trigger FND? Well, again, there are emotional stress and psychological triggers, traumas that can do that, but also physiological things can happen, such as having a concussion. So concussions, we know, skew the way that the interconnectivity in your brain actually is able to work. So it's decreases the way that your brain's allowed to have the pieces of itself talk to each other. And so because of that, the signaling can be skewed. But then oftentimes on actual scans, it isn't showed by structural damage. Illnesses can cause this. So bacterial infections, viral infections, those are known to cause problems with interconnectivity in brain regions. Chronic pain, again, can cause that. And then what I want to also say is that, however, there's not one true trigger for FND, and not everyone with FND has an obvious trigger. So that helps us understand that. I really appreciate the new updated 2022 version of that text, because it allows us to understand that sometimes there's not a true trigger and we don't quite know why the things happen. We don't have the nature of what started the event, but then we can look at the symptoms and go, regardless of the understanding of what the actual cause was, this is the type of thing that you're dealing with. So these are just some of the brain networks that typically have dysfunction in a patient with FND, because it involves altered communication. So this can be, realistically, you can have problems in a lot of different areas of your brain with this disorder. But some of the most common ones are that motor cortex, so that deals with some of the tremors and things like that. It is understanding why you can have gait problems or different motor outputs that are not correct. The limbic system is also strongly involved, and so that's actually a group of structures in your brain that helps you process emotions. So functional MRIs and PET scans have demonstrated that the brains of patients with FND show measurable differences in activity in certain areas of your brain. So one of those areas that often is pulled up to have increased activity is emotional processing centers. And so that's why I believe that it is historically been pushed off as a psychiatric disorder, is that there is a problem with the emotional processing centers, such as the amygdala, that can influence things like even motor systems. But there's a really strong emotional drive in a lot of these patients where emotional events can trigger symptoms. But that's usually because there's a really high firing limbic system that's not allowing them to downregulate other things that are happening in their body. Prefrontal cortex is involved, so that's your executive functioning. It's also your movement, but it's things like having the drive to get up and go do things. Your cerebellum is your coordination and balance centers. Also does a lot of other things. So that's where your vestibular system can get involved. That's where dizziness and visual issues can come into. And then your basal ganglia, which typically you see basal ganglionic issues with things like spasticity. So people can have rigidness to their movement. which can all be affected in FND. So evidence-based treatment, and this is a typical medical approach to treating FND. Historically, it's been treated with a multidisciplinary approach. So those things include neurological rehab, physical therapy, psychological therapy, vestibular therapy, and autonomic regulation. And that is why I think the functional neurological approach sits at the cornerstone of treating this disorder, because we look at your body as a whole and the connectivity as a whole. We check your autonomic system. So we look and see that's your system that should be doing things automatically. So that's your heart rate, your blood pressures, how your blood's flowing around your body, your respiration rates. And so we look at that really, really closely and we go, well, are you getting blood flow and the nutrients you need to the areas of your brain that you need for them to actually be able to speak to each other well? We check your vestibular system. We check your eye movements, which tell us a lot about the different areas of your brain and how they're functioning together. We check your balance. We check sensory integration. So how is the information coming into your body, be that vibration or sharp and dull sensation? How is that sensory system working? Is it integrated in the fact that you're getting a good information in for it to integrate in your brain correctly and have a good motor output out? Our approach is different because we understand the brain networks and how they communicate together. And then we are able to identify dysfunctional signaling and then target our neurological rehab to help with that dysfunctional signaling. So that can be anything from checking, we do a host of neurological testing, orthopedic testing, we check your musculoskeletal system, and we just look and see there are a lot of different ways that you can test brain function. So that could be everything from doing a pincer to try to tell if your frontal lobe's working well, or doing different movements to see if your cerebellum's working well. And then we do a host of different testing to help see how that connectivity is working for you. So the big thing that we work on in our clinic is the concept of neuroplastic changes. So because those neural networks are just having a problem communicating with each other, we work to make them communicate better so that you can have structural change where your neurons are actually connecting in your brain to be able to have an interconnectivity that allows you to have a better lived experience. So we're not just reassuring you, and we're not just giving you symptom management. We're not just giving you breathing exercises to calm down your anxiety, to not go into an FND flare. We're actually looking at what systems are firing high, what systems are firing low, and how we can get those to speak to each other in a manner that makes your day-to-day life better. So these are a couple examples of rehabs that we have in our clinic, or different things we'll do with patients. This is all based on what's happening for you. So your doctor will come in, they'll do their day one exam. It's a pretty comprehensive, 3-hour long exam where we check your eye movements, we check your blood pressure, seated, lying, and standing, heart rate, seated, lying, and standing. We look at how your system is handling gravity with your movements, how your cognitive abilities are doing with different neurocognitive testing. And so these are just a couple examples. The picture here on the left, on the screen, there's what we call a geoboard, where you're taking an image on a grid, and you're being able to, your ability to flip it or rotate it or change it. And that tells us about your ability to orient your world and understand where things are in space and how they move, because that can affect areas in your brain that affect movement. We have balance therapy here on the right. So on the screen, you can't really see it very well. We have a virtual reality machine where there's force plates on the ground. Those little blue squares down there that my patient on the right standing on are measuring her centers of pressure in her feet and her center of pressure in her body. And we're working to teach her how to move her body in a more appropriate manner. But it all depends upon what exactly is happening for that specific patient with FND. And then we go and help integrate it in their system, because your brain thrives on feedback. So it's giving your brain the ability to see, oh, this movement pattern isn't correct. I get the visual feedback. I get the sensory feedback, or the proprioceptive feedback from the movement, to understand how to actually connect those neurons to make that movement more appropriate. And so one of the things here is that we try to set as clear expectations for recovery as humanly possible. And the big thing with these is that recovery is often gradual. So this is not some type of light switch. We, turn the brain on and now it's working. It's a gradual process. It is stepwise. And then often in many of the disorders we treat, not just FND, it's a nonlinear process. So we walk through that process with you of the ups and downs of your disorder. One day might look a little bit different than the other. It often does. And so we have not just this, we have this little step and then this little step and this little step. There is an up and down to life that we all understand and experience. But in these cases, especially, there are, as you start getting back into the world and doing more at work or at home or whatever it is, we walk through that process with you to help manage your life in a way that helps you feel better in your day-to-day, and understanding that some days are going to not be as good as others, but the trajectory is going to be typically and hopefully an upward trajectory where your life's getting better and better as we do these treatments. One of the things is that recovery is possible, and I mean that as far as FND does not involve permanent brain damage. So while if you lose a limb, the chances that you're going to regain movement back in a limb is pretty much non-existent. But because there's not a permanent structural damage in these cases, the neural networks that help your brain and your body communicate to allow you to go live your life the way that you would like to can recover. And so the outlook with these can be really positive. It doesn't necessarily mean it's going to be an overnight, experience, but it can be really positive because there's not a structural damage. And so we don't have to fight the fact that we have patients that whole pieces of their brain are missing from stroke or from, different disorders, from tumors or, removals that needed to occur because of life-threatening disorders. Those things, we're not fighting those things. So your system has the ability to rewire, reconnect, and help you have a better day-to-day experience. So the picture behind here is our team. Everyone here would be more than happy to work with you. And if you have experienced these symptoms, you don't have a clear understanding of what's going on with you, because a lot of times, unfortunately, with an FND diagnosis, there is a lack of clarity for patients behind what's really happening for them in their body and what's occurring on a day-to-day basis that can help that can trigger things or cause things, or how they can downregulate those problems. We would love to do a consultation with you to see if you're a good fit for our clinic and we're a good fit for you. So you're welcome to schedule a free consultation. Our email address is listed here. Our phone number is listed here. We have a contact form on our website, and everyone at GCNC would be more than happy to speak with you, work with you, and we just want you to know that there is hope out there for FND as you navigate these tough times for yourself or for your friends and family. We love to be a part of your team if you would like us to be. So feel free to give us a call, and we will get you set up with a consult to try to get your health moving forward. Thank you.